Welcome to Medical Lectures channel. In this video, we are going to discuss diabetes. What is basically diabetes? What are the types of diabetes? Symptoms of diabetes? How to diagnose a person suffering from diabetes? And at the end, we are going to discuss how to treat diabetes. What is diabetes? Diabetes is a condition that happens when your blood sugar is too high. It develops when your pancreas does not make enough insulin or any at all, or when your body is not responding to the effects of insulin properly. Glucose basically comes from carbohydrates in your foods and drinks. It's your body's go-to source for energy. Your blood carries glucose to all of your body cells to use for energy. When glucose present in your bloodstream, it basically needs help to reach its final destination. If your pancreas is not making enough insulin or your body is not using it properly, glucose starts to build up in your bloodstream, resulting in high blood sugar level. The condition is known as hyperglycemia. Over time, having consistently high blood glucose level in your blood can cause health problems such as heart disease, nerve damage, and eye issues. Types of diabetes. There are three types of diabetes. Type 1 diabetes is an autoimmune disease. The immune system basically attacks and destroys cells present in the pancreas, where insulin is made. Its cause is still unknown. Type 2 diabetes occurs when body becomes resistant to insulin produced by pancreas and sugar starts to build up in your blood. Gestational diabetes is high blood sugar during pregnancy. Insulin blocking hormone produced by placenta causes this type of diabetes. What are the symptoms of diabetes? Increased thirst, which is known as polydipsia, frequent urination, which is known as polyuria. The person might feel some sort of fatigue. They might undergo blurred vision, unexplained weight loss, numbness or tingling in individuals' hand or feet, slow healing process in patients who are suffering from diabetes, frequent skin or vaginal yeast infections. Diagnosis of diabetes. Your doctor can diagnose diabetes, prediabetes, or gestational diabetes using simple blood test. The blood test will show if your blood glucose level, also known as blood sugar, is higher than the range that is healthy for you. Blood test can also help identify the type of the diabetes that you are suffering from. One of the tests for the diagnosis of diabetes is HbA1c test. This test measures your average blood sugar level over the past 2 or 3 months. Values below 5.7% is considered normal. Between 5.7 and 6.4 indicates that you have prediabetes, and 6.5% or higher indicates that you have diabetes. Another test that is used for the diagnosis of diabetes is known as fasting blood sugar test. This test measures your blood sugar after an overnight fast, like you are not supposed to eat anything. A fasting blood sugar level of 99 or lower is considered normal. 100 to 125 indicates that you have prediabetes, and 126 or higher indicates that you have diabetes. Third test that is used for the diagnosis of diabetes is known as random blood sugar test. This test measures your blood sugar at the time that you are tested. You can take this test at any time and you don't need to fast first. A blood sugar level of 200 milligram per deciliter or higher indicates that you have diabetes. How to manage diabetes? There are 4 main aspects of managing diabetes. The first one is blood sugar monitoring. Monitoring your blood sugar level is key to determine how well your current treatment plan is working for you. It gives you information on how to manage your diabetes on a daily basis. You can monitor your blood sugar levels with frequent checks with a glucose meter and finger stick, or with a continuous glucose monitor You and your healthcare provider will then determine the best blood sugar range for you. Second one is oral diabetes medications. Medication basically helps to manage blood sugar level in people who have diabetes but still produce some insulin, mainly people with type 2 diabetes and pre-diabetes. There are different type of medications that are used for oral diabetes, but the most common medication used for diabetes is metformin. The third method that can be used to manage diabetes is insulin. People with type 1 diabetes need to inject synthetic insulin to live and manage their diabetes. Some people with type 2 diabetes also require insulin. There are several different types of synthetic insulin. They each start to work at different speeds and last in your body for different lengths of time. The four main ways you can take insulin include injectable insulin with a syringe, means shot, insulin pens, insulin pumps, and rapid acting inhaled insulin is also available for treatment of diabetes. The fourth method, which is used to manage diabetes, is diet. Meal planning and choosing a very healthy diet for you are the key aspects of diabetes management, as food greatly impacts blood sugar level in your body. Healthy eating habits can also help you manage your weight and reduce your heart disease risk. The fifth way to manage diabetes is exercise. Physical activity basically increases your insulin sensitivity and helps to reduce insulin resistance. So regular exercise is a very much important part of management for all people who are suffering from diabetes.